Welcome back to my channel. I'm Starseed. Today I'm going to talk about dental bullying. Have you ever been to the dentist for a routine checkup, and after a quick review, the dentist insists that you need more costly work than what you went in for? And you might feel like you're being bullied into something that you don't want or need. Well, don't brush off your concerns, because if you have to think about, you have to look at the dentist side eye and say, you know what, something do not feel right. Why are you telling me that I need something more than what I came in for? And not just that, I don't even feel the symptoms of what you're telling me that I need. Medical bullying can be a problem. Dentists use their expertise as a way to talk patients into expensive surgery, and sometimes most will say yes because they believe their dentist, their doctor, who you're supposed to trust. You believe him or her because of that impressive white coat. Now, if you're uncomfortable with a diagnosis or recommendation for extensive and expensive work, it is wise to seek a second opinion. My husband went to the doctor, the dentist, a couple days ago for a routine checkup. And not just that, he had some little irritation on his back tooth. So he wanted to get that checked out. When the x-rays were, when they came back, the dentist told him that he needed to get 6 teeth pulled, and that he would need to get dentures. Really? He is gonna need dentures. I asked him, he called me first of all, and I asked him, I said, have you been experiencing any pains or discomfort in your mouth or teeth? He said, no. I said, are your gums bleeding? He said, no. I said, well, 9 times out of 10, if they telling you got to get your teeth pulled and you're going to need dentures, there got to be something going on with your gums. You got to have gum disease. Your teeth or your gums are not bleeding, so therefore something is off. So I immediately told him to walk out of that place. Leave now. So instead of him walking out, he went to another dentist who he was familiar with that was in the same facility, and he asked her to check out his results, his x-rays. And so when the dentist checked it out, she said, oh, no, I don't see that issue. I don't see that you need all of your teeth pulled out. What I see is you do have some issues going on with your back tooth. Maybe that tooth can be extracted, but what you really need is a deep clean. However, this is the catch. You're going to have to pay $500 for a deep clean. I said, wait a minute, $500? $500 for a deep cleaning? Now, we have awesome insurance where they cover teeth cleaning. Now, in the past, when I had to get a deep cleaning done on my teeth, the only thing that I came out of my pocket was like $130 or $140. Now, all of a sudden, you're saying that we have to pay $500 for a deep cleaning? No, I'm not buying it. I told him to leave that place. Do not go back. I am changing doctors. I am changing dentists ASAP. Leave that place now. He was terrified. I said, do not believe that. Do not accept that. If you're not experiencing those things that I mentioned, you're fine. And I told him, in matter of fact, you can repair whatever they're telling you going on with your gums, or if it's receding or whatever, you can repair that. I said, you can start by brushing your teeth at least 2 minutes at a time. And you can also use neem toothpaste, which repairs cavities, and also it repairs gum disease, if that's the case, which he does not have because he takes really good care of his teeth. We as consumers, we have to worry about going out into this world, finding people who are ethical, who have ethical business practices. We're supposed to trust our doctors, our dentists. You know, if we can't trust them, then I don't know who we can trust. I said I am going to find an ethical dentist, one who practices good business savvy, and those who look out for their patients. I'm not going back there, and I told him, you're not going back either, and I'm gonna make sure of it. I requested to change facilities with my insurance company, and they did it immediately. And so I told him, next week, you're gonna schedule an appointment. Now, once they take another x-ray of your mouth and they don't give you the same diagnosis as she did, I will be filing a complaint with the National Dentist Association, because we as consumers and patients shouldn't have to go through this trauma, okay? We're not supposed to go through this. A lot of us don't have the extra money to be paying into, these different prognosis or treatments that they say we need when we really don't. Years ago, the same thing happened. Well, something similar, but the same thing in the sense where they told me that my daughter needed to get more of her teeth. They said she needed about 5 to 7 cavities filled. And so I'm like, I'm not gonna allow them to drill holes into my daughter's teeth. I am going to have her to brush with neem toothpaste at least 2 to 3 times a day for 2 minutes. I'm gonna monitor her, and I'm gonna have her to brush for at least 2 minutes. And so she did it, and I'm telling y'all, about a year later, we went back to another dentist, of course, and they took x-rays, and they did not find one cavity in her mouth. She repaired those cavities by brushing her teeth with neem toothpaste and brushing properly. It's very important. So, if you're not feeling what your dentist is telling you, and you know that something is not right because they're exaggerating they're telling you that you need all of these things done to your teeth, all of this work done, and you gotta pay so much money to make sure your mouth is in good order or your teeth is in good order. No, always get a second opinion. Always. We have to go through so much as consumers. We gotta already battle against these people that's outside in the world. We gotta go out here and make sure we find a good mechanic who's not gonna rip us off, who's not gonna take an arm and a leg from us. We gotta worry. We already gotta worry about making sure we have the right physicians, medical doctors, who's gonna look out for our best interests and who's not gonna tell us that we need so many different things done just so they can make a quick buck. We don't need that. We need ethical people who are gonna look out for us. These people who are supposed to be experts in their field. Don't tell me that I need 100 things done when I only really need one thing done or nothing. So, in essence, before you agree to anything that these dentists are telling you that you need, always get a second opinion. All right? Thank you very much for taking the time out to listen to this video. Hit that like button and don't forget to subscribe to my channel if you have not done so already. See you in my next video. Peace.